Thank you for your time today, team. I want to discuss with you today the coroner's case of young Georgia Ray Tillmouth, who passed away on the 23rd of August 2006 at the Royal Darwin Hospital. Georgia was born extremely unwell and died 13 hours later in the NICU. Georgia died because of organ failure caused by not receiving enough oxygen during her labour. Let's discuss what lessons we can learn from this sad incident so that it never happens again. Many aspects of Georgia Ray's case may have altered the end result if done differently. The issues that I want to highlight to you today are: number one, good team communication. Each person on the maternity team needed to acknowledge the increased risk of Juliana's labour as she was 37 weeks gestation and provide care accordingly, as 72% of failures in maternity care are linked to communication and teamwork. That brings me to my second point, teamwork. Each member of the team providing care for Juliana needed to be working towards a common goal and vision, and this didn't happen that day. Number three, staffing. A junior midwife was the primary midwife providing care for Juliana, and she was assisted by a junior doctor that day. It would have been good if these junior staff were supported appropriately, as neither of the staff had been given a thorough orientation to the birth suite, and that could have helped them to locate equipment when Georgia Ray was born so unwell. And also, Georgia Ray's mother, Juliana, was not aware of the two staff that were looking after her that day, that they were both junior staff, and also each staff member, the two junior staff working together, weren't aware of the skill mix and of the roles and responsibilities of each team member involved in this birth. Number four, the guidelines of assessment for preterm labour and birth weren't followed correctly, as regular reviews by a senior midwife when CTG monitoring are required in a normal birth, and Juliana's birth fell into the higher risk birth category because it was a preterm labour at 37 weeks. My last point is ability to use equipment. The CTG trace to indicate intrapartum hypoxia wasn't interpreted correctly, and if it was, Georgia Ray's birth would have been organised a lot earlier. If a staff member is unsure of an interpretation, it's so important to call a senior midwife, and if they're unavailable, to call a doctor in to have a medical review of the CTG trace. I would rather ask what may be considered a dumb question than lose a life because I was too embarrassed to ask for help. There are many lessons that we can learn as a multidisciplinary team to provide good quality care to our patients and their families from this coroner's case, and I hope by reviewing this case today we can work towards applying them together. Thank you for your time.